Hello beautiful ladies. Hope you all are doing well and keeping yourself safe. My name is Dr. Meenal Dhabalia. I am an obstetrician, gynecologist and infertility consultant with a special interest in laparoscopy and hysteroscopy. Today I am going to discuss very important topic of symptoms of early pregnancy with a special mention of the symptom which you may have before you miss your menses. Yes, you heard it right. Before you actually miss your menses, there may be few symptoms which may indicate that you are going to get pregnant in this cycle. Now what are those? Coming to the actual topic. Coming to the physiology of pregnancy, ovulation generally occurs between day 12 to day 16. Once ovulation occurs, this egg or ovum get fertilized by the sperm and then there is a formation of the embryo. Then this embryo finds its place inside the fundus of the uterus and get implanted in the fundus of the uterus. Once it get implanted, it starts secreting a hormone known as beta-HCG hormone. This is a pregnancy hormone, and this hormone then get mixed in the circulation of the female, and this hormone is the most important hormone of the pregnancy and it's responsible for giving you so many symptoms. The first and foremost symptom of this time is nausea. What is nausea? Nausea is feeling like vomiting but not actually vomiting. And as I told you before, beta-HCG hormone is responsible for this for this symptom of the pregnancy. Second and most important sign is increase in the size of the breast, pain in the breast, and nipples become very sore and tender. Now, some type of pain is also common before menses in young female, which is known as premenstrual syndrome. And in premenstrual syndrome, pain in the breast is generally on the lateral side of the breast, and it is short time. In 2 or 3 days time, generally those pain disappears. But in pregnancy, pain is continuous, size of the breast increases, and with that nipple become very sore and tender. And if you press the nipple, there may be 1 or 2 drop of milky discharge or colorless discharge. This increase in size with the pain in the nipple and discharge from the nipple is one of the very important symptom of very early pregnancy. And the third symptom is implantation bleeding. What is this implantation bleeding? As I told you before, once the embryo get implanted inside the fundus of the uterus, while implantation there may be slight erosion in the wall of the uterus, which may give rise to 1 or 2 drop of blood, which may trickle down the vagina, and female may notice 1 or 2 drop of pinkish or reddish discharge, which may disappear on its own. Generally, this implantation bleeding occurs 5 to 7 days before your menses. So, before you actually get your menses, these are 2 or 3 symptoms which you may feel, and this may indicate that yes, you are going to get pregnant in this cycle. Now, once you miss your menses, what are the symptoms in the early pregnancy? First and foremost is definitely a absence of menses. Those who are having a regular cycle, young female trying for the pregnancy in the reproductive age group, if they miss their menses, the first and foremost diagnosis is pregnancy. Second is, as I told you before, nausea. Nausea is because of the pregnancy hormone beta-HCG. Patient starts feeling lot of nausea. The initially, which was very mild, becomes more profound, and few females may start vomiting also. This nausea and vomiting may give rise to lethargy and tiredness in the pregnancy. One of the symptoms which may patient feel in early pregnancy is frequency of urination. They feel like going to the loo frequently, though there is no infection, and this is because of the pressure symptom. As the uterus is increasing in size, it gives pressure to the urinary bladder, because of which you may feel like going to the loo frequently. There is no infection in the urine or the urinary bladder, so no need to take antibiotic or any medicine for this. Once you complete the 3 months, this pressure on the bladder eases out as uterus will become more abdominal organ, and the symptoms will go away. So this is a purely symptom of the first 3 months of pregnancy. Most of the female also complains of constipation. Now see, beta-HCG hormone has a different effect on the female system, especially on the gastrointestinal or intestine of the female. Most of the time they have nausea and vomiting. They are not eating perfectly, they are not taking a fiber diet, their hydration is not there, plus the effect of the hormone on the intestine, all this lead to the constipation in early pregnancy, and most of the female in early pregnancy complains of the constipation. Try to increase your fiber diet in first 3 months of pregnancy. Even if you don't feel like eating, you have to eat healthy and nutritious and fibrous diet. Take a lot of fruits, keep your hydration maintained. This is going to reduce your constipation. But if you are still having a constipation, you can take the safe medication during this time. Few females can have severe headache in early pregnancy or nagging type of headache because you are not eating properly, because of nausea and vomiting, your diet is not perfect, you may feel like hypoglycemia, that is your sugar level may go down. This low sugar levels may give you nagging type of headache. Again, I am emphasizing on the importance of the healthy and nutritious diet in pregnancy. You have to take small frequent meal in pregnancy so that you will not have all these symptoms. Most of the female in first 3 months also complains of or can also have the symptom of backache. See, pregnancy is growing inside the uterus in the pelvis, so most of the blood circulation goes to the pelvis, and there is a blood congestion in the pelvis. This congestion can give rise to dull type of ache in the back in the female, and for this you may start doing light exercises or back stretches, and if you like you may start hot fermentation. Again, no need to take antibiotic, and it is not required to, and it's not going to relieve your problem. So doing a back exercises, keeping your exercise level and few stretches is going to ease this problem also. Few females may have different type of problem. Few gain weight, few lose weight, few patient complains of hair loss in pregnancy, and few may have weird eating habit, like they will want to eat spicy food, outside food. Female like to have chalk or clay. See, ladies, pregnancy is important time of your life. You have to see to it you eat healthy and nutritious and balanced diet. You should eat at least 3 to 5 small frequent meals with the adequate fruit intake, fiber diet, and vitamins, which it should include protein, carbohydrate, vitamins and minerals. Keep your hydration maintained. This is a very important time of pregnancy. If you'll take care of this, most of the symptoms will reduce to some extent, and if you start a pregnancy on the healthy note, you are going to have a healthy and absolute healthy pregnancy is going to give you a very healthy and very healthy baby in the end. So when as early as you miss your menses, it's always better to go to a gynecologist, get yourself checked, and he or she may advise you to do few tests, and they may start you folic acid or prenatal vitamins. In fact, it's a best idea to visit a gynecologist before even you plan your pregnancy, so that you and your partner can do few blood tests like thalassemia, anemia, his semen analysis, your few blood tests, and you start a pregnancy on a very healthy note. You start your folic acid even before you plan for your pregnancy. Hope you like this video, ladies. Take care and be safe. Thank you. I'll be covering more topic on pregnancy in the future. So do like and subscribe. And do let me know in the comment section what all topics you want me to cover. And if you have any question, please feel free to ask me. I'll be happy to answer all your queries.